Right. So, okay. What I hear you saying is that then you're utilizing smoking cannabis as a coping mechanism for your insomnia that's part of your PTSD symptoms. Okay. And so I think that that is a fair coping mechanism, but I'd like to just take the next few minutes to give you some more further information and education on cannabis so that you can make informed decisions within the cannabis. So we have two major active ingredients. We've got THC and CBD. THC is your psychoactive ingredient, whereas CBD is your what's used for more medicinal purposes. You don't get the mental high that you would from the psychoactive ingredient in THC. Then within the plant strains themselves, there's two major um, strains. There is sativa and indica. Excuse me. And sativa has lower THC, indica has higher THC. So, as a drug classification, cannabis is a mixed effect drug because it affects within your central nervous system both as a stimulant and a depressant. And you're utilizing it as to enjoy the effects of the depressant, being the relaxation, the drowsiness, the calmness that you're getting, and that's assisting you with the sleep. And so there's different ways that you can use cannabis. There is smoking, which you have indicated, so that's considered inhalation. And then there is also oral ingestion, so that could be oils within capsules, that could also be infused edibles or gummies, and then there's topical creams or ointments. And so within those, the inhalation is not the best choice because you're going to get like the chemical ingestion in your lungs. It gets you the fastest high, but it's not necessarily the healthiest way to ingest through your body. Um, in terms of looking at dependence and tolerance, doing something like a gummy that's going to be ingested orally, it takes longer for you to get high. And so that can aid in keeping your tolerance lower. We want to keep tolerance lower, meaning we don't want you continuing to build up higher levels of THC usage. That way, you don't become dependent, because then when you try to come off or stop using the cannabis, you're going to have withdrawal symptoms. And with cannabis, it's a physical withdrawal. So you would have symptoms such as the shakes, nervousness, insomnia. And now we've come full circle in that the reason you started using cannabis as a coping mechanism to help insomnia, you're now having insomnia as a physical withdrawal symptom. So we definitely want to avoid that. So just to look at some harm reduction, there's different things you can do. You can switch out drug substitute, routes of administration, dosages, and frequency. So you're just using it before bed. So what I'm going to recommend is that you switch to a gummy and that you switch from an indica to a sativa to keep your THC level lower. And that way we can focus on the concurrent disorder that we have at hand. Ultimately, we want to treat your PTSD and the trauma that is causing the PTSD, so that ultimately this is a coping mechanism that's not a permanent use. And hopefully this information just gives you a little bit to be able to make some better decisions. I'm happy to answer any questions that you have. And I look forward to working with you on your journey. Next week, we'll dive deeper into working on some of your traumas. And I'm here for you whenever you need anything. Thank you.